We wanted to create a patient encounter in the simulation room where second-year students could come in and evaluate a man recovering from a myocardial infarction. So this patient encounter was a simulated experience inside our great sim lab. About 48 hours before the students met the man recovering from a myocardial infarction, his name was Mark, the students looked at an electronic chart. And so this was a way of introducing them to a form of digital health the day of the encounter. They would speak to the nurse. This helped build interdisciplinary communication. Then they went in and interviewed the patient. Then they conducted an exam. This was a time for them to practice their hands-on skills. There were a couple components in the exam that threw the students some loops for clinical decision-making. So then after the exam, the students came up with interventions for Mark. They put him through some interventions. They concluded their exam and their evaluation and came out and talked to the nurse one more time to help build that interdisciplinary communication. The point there was for the students to convey the problem that they saw in the exam. Then the students left and they came into a debriefing room with the expert faculty, and then we answered their questions and we discussed and probed their clinical decision-making regarding the hemodynamics that were either too high or too low or normal. And that was the conclusion of the patient encounter.
I just enjoyed being able to practice my skill and not be too stressed that I was going to hurt anybody.
And in particular, having a live patient there was really helpful because it helped us to get a sense of what the pacing is when you're having a conversation with somebody. And that's, for me, that was very different from working with a mannequin or even working with another student, because you start to get a sense of how people are really going to respond to something